we were really excited about the UN's high-level meeting on promotion and prevention of non-communicable diseases. This is the second time ever that the UN has actually had a high-level meeting on health. And in 2001, it was on HIV/AIDS. And of course, you know the United States is very committed to HIV and AIDS. And now it's on non-communicable diseases. And that's really important to us as well, because as you know, 1 in 3 adults are either obese or have overweight. And now we have almost triple that with children. It's a third of our children are overweight or obese. And if we don't do something to stop that, it'll get worse. And so my first paper was the Surgeon General's Vision for a Healthy and Fit Nation to start to address overweight and obesity in this country. And so I was also really pleased to join the First Lady with the Let's Move that's addressing the issue with children, particularly trying to stop this trend in one generation. And so we've been working on this, and we've been working on it for a while. And to now bring it to a national level is important. We see the same problems and the same issues over that's happening in other countries and not just in the U.S. And so to be able to have an opportunity to dialogue, to talk with the other countries about what they're doing and what we're doing, hopefully we can work together and combat this problem throughout the world. We can start addressing the issue of how the non-communicable diseases and the chronic illnesses and chronic diseases are starting to affect our global economies, to affect our individual citizens of our countries, and hopefully we can prevent those 5 leading causes of death. We know that if we address those issues, we can prevent and certainly decrease the 5 leading causes of death, which of course is heart disease, lung disease, strokes, and accidents. So, and of course diabetes is there too. So. Well, we were really pleased to be a part of the WHO committees that put together and tried to develop some of the things that we're going to use to measure some of those targets to measure the outcomes. And over the next few years, we'll be participating in how to measure those. But the biggest measure is that we're starting to prevent those leading causes of death. Well, some of the things we're doing in the Affordable Care Act or the Health Reform Law, there was a council that was established, a National Prevention Council, and that brings together 17 cabinet-level members to look at prevention in the United States. And there was a solid commitment, both financial and policy commitment, to start to look at prevention in the United States. We released our first national prevention strategy ever. And so in that strategy, we laid out some things for the nation to do that if we do those things, we can ultimately prevent or at least significantly decrease those leading causes of death. And that encourages everyone to start looking at health in a different way. Change our focus from a disease and illness-based system to one based on wellness and prevention. And that's just the way we start to look at things, and to know that health is in everything we do, everything from our environment to our highways to riding our bikes to school. It's every place that we work, we play, we pray, we exist. And so we want to make sure that you think of health not in a negative way, but in a positive way. We need to involve everyone, from the government to the private industry, to individuals, to churches and religious groups, for industry, for researchers and academics. It has to be across all sectors, the nonprofits, the civil society, everyone. This is all of our issue, and in order to overcome them, we have to involve everyone. And we also have to basically start to address some of those social determinants of health, that we know that poverty is probably one of the biggest leaders of determinants of health and health outcomes. So when we start to look at all of those, it has to involve all sectors, not just government, but government can be a leader. this UN meeting brings it to a level of visibility that we needed. We're out there talking about it. We're trying to make sure that everyone's starting to engage in being healthy lifestyles, moving, active, playing, having fun. But to say how important it is when it becomes a issue for the United Nations, it's not just my little part of the world, it's the entire world that's looking at these issues, and how important it is for us to combat chronic diseases and non-communicable diseases brings it to a different level of attention. And that's important, particularly when we're trying to talk to a small town about putting in a sidewalk, how important that is. And you may not see it as easily as if you see other countries having those same issues and how they've improved by getting these things done. Little changes that you can do by having the lights on at a playground later in the evening. Those little things may seem small to you, and it may cost, a little bit more to keep the lights on longer, but you may be preventing people and kids from being ill with the 5 leading causes of death 10 years from now. So you want to make sure that these are important and that the UN is bringing it to that level of conversation and understanding.